Okay, this is the video competency for oral temperature. So the first thing that we're going to do, like we always do, is we'll go to the other room and we're going to wash our hands and gather our equipment. So I've already done that piece. I have my patient's chart, my black pen. I have a thermometer with probe covers in the exam room. So I'm going to call my patient, Amani. Hi, Amani. We're going to go in this room right here. I need you to have a seat up here on the table for me, please. Thank you. Amani, could you give me your birthday, please?
1797.
Okay, perfect. That's what I have in the chart. So remember, we always want to verify patient's date of birth no matter what we do with them, and we want them to tell us their birthday. All right, Amani, what we're going to do today is go ahead and take your temperature, okay? So I have a thermometer here, and remember, we always want to select the blue probe. The blue probe is oral. A red probe would be rectal. So we're going to do an oral temperature on the patient today. What I'm going to do is take the probe out. The thermometer will automatically come on. I'm going to put a probe cover on top of the probe, so we want that as protection to cut down on disease and contamination, cross-contamination. Amani, what I'm going to do is have you place this underneath your tongue, okay, to the side, all the way in the back, and then I want you to make a tight seal with your lips around it, but don't bite down on it, okay? Have you by chance had anything hot or cold to drink or smoked in the last 30 minutes? Okay, great. So those are questions we all need. We need to ask the patient about hot or cold items to eat or drink, if they smoked, and then also instructions on exactly where and how we want the probe placed on the patient. Now I can do one of two things at this point. I can hand the probe to the patient to place in her mouth, or I can go ahead and place the probe in the patient's mouth and hold it. So it's a personal preference. I don't care which way you do it. All right, Amani, we're going to put this under your tongue. If you want to hold it, you can. And I'll let you know when we're finished. We're going to wait the appropriate amount of time. The thermometer is going to beep when it's done. Okay, great, perfect. She did a good job. I watched and made sure that her lips were sealed around it. I can't see if she had it in the correct place under her tongue, but I'm going to assume that she did. And then I'm going to look at the digital readout on my thermometer, get rid of the thermometer probe. So this blue portion on here has popped up once I have a probe cover on there. So I'm going to open up my trash can, push down on that blue button, and that's going to release the protective covering and put the thermometer back in the holder. Now I'm going to take the chart and I'm going to do my documentation. We're always going to start with our peanut butter and jelly, our date and time. And I'm going to put a capital T for temperature, and then the digital reading that was on the thermometer and degrees Fahrenheit. And then what I'm going to do is bring my name out to the edge, and I'm going to sign. So remember, we always want to go margin to margin when we document in our patient's charts, okay? So the next thing I'm going to do if I'm just taking temperature is I'm going to let the patient know that I have her temperature recorded and that she can just wait in the examination room until the provider comes in. All right, Amani, we have your temperature now. The doctor will be in for you in a few minutes, okay?
Okay.
All right.